Thanks for staying with us. The program is still the conversation on Lagos television. Today, we turn our attention to an issue that touches every Nigerian, the young, the old, the rich, and the poor. I'm talking about the Nigerian healthcare system. You will agree with me that an effective healthcare system does not just affect how long we live, but how well we live. And to help us unpack this important conversation today is the first Vice President of the Nigerian Medical Association, NMA, Dr. Benjamin Oluwojebutu. Thank you very much for joining us on the program. I took my time to pronounce your name. Did I correct? Okay, I pronounced it correctly. Thank you very much. Yeah, thanks for having me today. Yeah, now,
I'm always glad to be here.
Thank you. Now, Dr. Oluwojebutu is a seasoned medical professional and health advocate. Now, doctor, let's go to the big question first. What does an effective healthcare system mean for a country like Nigeria?
Okay, so it is important that we understand that health is not just how good you look, it's how well you are spiritually, financially, healthcare-wise, mentally. Now we live in a country that has a lot of issues. You know, now there's a new tax law that's going to make healthcare a bit very, very unaffordable this time, because everything you do now, you pay taxes on top of it, and we don't earn as much as we should earn. So an effective healthcare system will talk about the value chain of primary healthcare, secondary healthcare, and tertiary healthcare, all functioning properly, optimally, which means you won't get somebody that having malaria and typhoid go to a tertiary institution. You'll get a woman that is having a baby, that is having antenatal, go to a tertiary institution. They will all go to a functional primary institution. And there's a good referral system. So if it can be taken care of at the primary healthcare system, is referred to the secondary, and from secondary to the tertiary. But you know, what we've seen in our country in the past few years is that even the baseline of primary healthcare is not as functional as possible. So it's not effective. So people that, because they want to be seen properly, they leave the primary healthcare that's meant to be primary. That means take care of malaria, typhoid, diabetes, hypertension, and take care of things like having a baby antenatal, but they're not coming there because they don't see it working. They go to the tertiary and it makes that place overcrowded, over busy. You now see people you now see doctors seeing over 1,000 patients on a clinic day because they've left where they should be. So for us in the new year, it's important we prioritize effective healthcare system where every facet of our healthcare system in this country is functioning, is properly equipped, and they have healthcare workers working there properly. Then we can cascade to the tertiary institution going forward. Yeah.
Earlier you talked about the new tax law and its effect on the health system. I need you to expatiate more on that. Okay,
so as I read it, even though it's going to give a lot of people, bring a lot of people into the tax bracket, very good, but the amount of tax you pay on everything you purchase now is a lot. In the VAT is a lot now, and so people have to now look at would they have to buy? So you go into the cab now. People tell you that don't put income there, put loan or put gift, so that it'll be a lot on the cutting. So people need to know that, and the budget for their health care for themselves will not reduce. So this is my advice to people this year. Preventive health care is important. So if you're hypertensive, take your medicine properly. If you're diabetic, take your medicine. So don't get into coma. Don't get into CVA. Don't get into hypertensive heart disease. So make sure you do your work properly. Do your exercises. Don't take a lot of salt. Take a lot of water. So if you are living your life properly, preventively, you won't get into that issue of spending a lot of money inside the hospital sick bed, because the tax will beat everybody now. You can't escape it. Even if you're a trader in Ojui, you will get to pay tax this time because the bracket has been enlarged now.
So we need to pay attention to preventive health.
Yes, very important.
Okay.
Have you checked the blood pressure recently?
Why are you putting me on the hot spot?
No,
not this year anyway. But I think I did last year, maybe 27, 28.
Yes, that's good. So it's important we're doing now. So
regularly. Okay, so
you don't wait until you have a serious headache. 2 days ago, I was reading something about a man driving on the road and just and they were onking their own, and they couldn't move again. Obviously, he had maybe had a cardiac arrest or a CVA because maybe his BP was very, very high, and he just slumped on the car. These things doesn't happen suddenly; they gradually. So if you don't take care of it early, you get to that point of having a cardiac arrest.
Okay, so from your perspectives at the NMA, how would you assess the current healthcare system in Nigeria now?
Truthfully, we're moving forward, but we're not there yet. You know, it's a lot of improvement, a little bit. At least the budget went from about 4.8% last year to about 5.6% this year. It's still far, far below the 15% Abuja Declaration of 2001. And the quality of accountability is my issue, basically. You know, you have several agencies doing several things in this country. The coordination of healthcare supply is very, very low. The acceptability of accountability is also very, very low, which means if you say the budget for primary healthcare is $1 billion, who makes sure that that $1 billion gets to where it should get to and is doing what it should do? We don't just talk about budget, talk about budget implementation. What is the percentage of what we do? How much training are we giving our healthcare workers? How much salaries are we giving to them? Because right now we have one doctor to about 10,000 patients in this country. That's a lot. And every day the people are living in droves. You can imagine the security situation is very, very bad. One of our very good friends in a psychiatrist in Enugu was just assassinated 3 days ago. Somebody's kidnapped in
Edo State, yes.
So those things are the push factors that send people away from this country, you know, because there's no security. So healthcare should be merged this year with concurrent security, so that the security of the healthcare workers are paramount to Nigeria this year, so that we are sure that it's a safe haven to live and work in this country as a medical practitioner.
Now, it is no longer news that Nigerians still struggle to access quality healthcare systems. So what are the major barriers? I know you say funding.
Obviously, no. But I won't start from funding. It's just the personnel. We don't have enough. And so you do the math yourself. You have over 250 million Nigerians. So 250 to about 300 million Nigerians now, because every year we increase about 7% every year. So let's say this year we're going to get about 380 million people in this country. And you have just about 50,000 medical doctors. And you have most of them are not, some of them are not even practicing medicine again. Some are retired. So let's say functionally you have about 30,000 doctors in this country that are seeing 300 million people.
That's
so
so good.
Obviously you cannot have enough access. Number two, most people that don't have proper education will be mishandled by those guys that work on people's psyche, lie to people. The herbal guys, the guys that say that they are the chemist guys, the guys that don't understand what's going on, and just play on your naivety and tell you to take this one. They call it Bubonishi. Sorry, it's always
exactly.
They'll say,
yes.
Take 5 meals. It's for malaria. 10 mil is for typhoid. 20 mil is for fibroid. 30 mil is for something. You know, so those things. So what we need to do in Nigeria going forward, I remember clearly when I was young, I used to remember National Orientation Agency.
Yeah.
Used to have like every Friday, they take a topic and talk about it in different languages. I'm sure you remember that time. Maybe you're not born in this time.
What year was that? What year was that?
So they'll talk about if there's a cholera outbreak, they'll come and do cholera stuff and say it in different languages, in Yoruba, in English, in Hausa, in Igbo, and they give what we call mass dissemination of information. So we need to get to that point again, where we have people talk about healthcare preventively on national TV. So that people that don't have access to healthcare individually can hear experts talk about it nationally. Okay. So people now know what they do need to do. Somebody will tell you that you put like 10 spoons of salt in your water and drink it, or drink your urine. You wear PKs. You know, people say a lot of stuff, but because they're not hearing from the experts. So Nigeria this year, government should invest in national orientation in healthcare practice, healthcare proper practice, so that our nation is healthier, our people are doing better. so that the people that are in the rural communities also hear from experts that these are the way things should be done. For example, you are pregnant, you don't try to give birth to your baby at home. Go see a doctor, go see a midwife, so that if there are any complication, they can know on time. So you don't say it's one daddy that is following you, or one mommy that is following you, or one village people are following. No. It's about getting the right information on time. Then government should be ready to fund healthcare properly and give adequate remuneration to healthcare workers in clear terms. It must be a very important part of the policy and the body language of government that they want to keep doctors in this country. In keeping doctors in this country is about proper welfare, proper security. Don't let doctors die. We are short of doctors and they are still dying. They're kidnapping them. This should be a priority, more like an emergency, that the government's body language must see that doctors feel safe and they can work properly with joy and happiness. Because if there's no remuneration, if there's security issues, people are dying, people will they'll be called lackluster. They want to leave the country and go to proper places that they can benefit their lives. And you can't judge them because somebody close to you. Andrew was my very good friend, the psychiatrist, very good friend that died in there, as I said, in Enugu. My very good friend. No, so if I'm not as patriotic or I'm weak like other people, the next thing is to jump away and just go because you don't feel safe. But we must create an environment that makes healthcare workers feel safe to do their passion, because we have the best medical doctors all over the world in this country, best training, but we must make them feel safe, make them feel welcome, make them feel loved, and let's have proper body language and policy to guide and guard them.
Well, you didn't talk about infrastructure. I was expecting to say something about our healthcare infrastructure.
You know, we're improving. Before we
are?
Yes. Before we used to have one cervical center in this country, one cancer center in this country, functional in Luth. But the last year we've had them build cervical center in all the geopolitical zones. You see a patient coming from Sokoto before to do radiotherapy in Lagos, or go and do one in Abia State. But right now there are 6 functional ones all over the country. That's like something with infrastructure. So we're improving access by infrastructure. But you can have infrastructure, but you don't have the personnel to handle infrastructure. So just be there and you become obsolete. So the point is, as we grow the infrastructure,
should also
we'll grow the capacity and grow the healthcare workers to run the places. So we're getting there. We're not there yet, but now we're beginning to think about access, not just in urban areas or places that we feel people should be more. Is now being done in places close to where people that are more populated. You have one in Kano, one in Sokoto now, one in Benin was just built last year. So I saw them do it last year. Then someone in Enugu also. That's like egalitarian. So people are feeling that they can have access. So people in the southeast know that they have a place they can go to. People in the northeast, in the northwest, people in the southwest, people in Lagos can go to particular places. Not just leave Lagos and you're going to do physiotherapy or the therapy somewhere in Kano.
Okay, so I want us to focus on our primary healthcare system now. We all know that the primary healthcare system is the foundation of any strong healthcare system in the world. So how well is Nigeria doing in this area?
We're not doing well.
At all?
At all. You say we're doing well in some urban areas. Lagos, fantastic, because Lagos is Lagos, you know. We're a center of excellence. We always lead. But if you look at the rural communities that need this primary health care more, access, the functionality of the equipment that are there, the access to healthcare in those places are the issues for us. So the primary healthcare, we spoke to the House of Assembly, House of Rep a couple of months ago on a bill that there should be proper funding. It should be in the law that there should be proper funding from the local government to the primary healthcare centers in places. And I think it's important that the politicians in those places also use those facilities. So if you use the facility that you build, it gives validity, it gives reference point that, okay, I, as the leader of this community, I also use this facility, then people can go there. But if you don't use it, people won't go there. So you have primary care centers that are very obsolete now because people don't use them and they're not popular. So it's important as a law to make sure that there's funding. Now that there's funding now autonomous of the local government, the primary care centers are actually the priority of local government. So let there be accountability that the funding for local government that are specific for healthcare system in primary healthcare system should be used adequately for funding and for what they should do.
Okay, so we'll be talking about funding, but people will say, is it just about funding or how these resources are managed?
That's what I told you about accountability.
Yes.
So I said it before that it's important there's a place of proper accountability and you call it budget implementation. So you don't just say this is the budget, say you have 1 billion to do this. How was that 1 billion used? How effective was it? So it's not only about what is the outcome, which means if I do, so this is how I look at it, population indices. So if this year we got 5 billion and we saw 300 patients, and you increase the budget from 5 billion to 10 billion, the outcome also should be seen more than 300 patients. Am I correct?
Yes.
But if you still see 300 patients with 10 billion, there's a problem.
A big one.
That means either the funding was not properly used or was stolen. So it's important not only to look at the budget implementation, you should look also at the budget outcome. What has this budget delivered to the people? Which means if you say we have 3 hospitals in Lagos and we have 35 million people in Lagos and we increase the budget from 7% to 10%. With the 7% we saw in 1 year, malaria of 2 million people. It means in the next year, we should see malaria of what? 10 million people. Because the increment in budget must bring together increment in outcome and value for the people we serve in this country.
Now I want us to turn our attention to the proposed strike by the National Association of Resident Doctors. Now people say doctors are always going on strike. Any small thing they will say they want to go on strike.
So for me, it's not like that.
Okay, so they said they are proposing a strike when I think January 12, yes, according to what we've heard. And the government is saying that they've spent money. They've given doctors allowances. Now, what else do they want? Why are they calling for strike again? What exactly is the issue?
So there was an MOU signed by government with NAD, I think, and in the MOU there are a few things that are not being sorted, but some have been sorted. I believe a roundtable discussion will solve this problem. Sometimes government, the attention to details are usually the issues. I get you. And number 2, the timeliness of the things that need to be done. And people believe that if you don't go on strike, you don't get it from government. I don't think so. Apparently, I don't think so. But that's what people think. And ASU went on strike and they got 40% increase in salary. Yeah. So if ASU went on strike and they got 40% increase in salary, it means it worked. Which means for you to get things done in this country, maybe that's the language the government understands. I don't think government should do that. I think government should be more proactive, more sensitive to the plight of people. If you know that you are losing doctors every day to other countries, people are dying, the safest, best thing to do is to just make these doctors comfortable, make them happy, make them feel honored to work in this economic hardship. Because what the doctor earns is not the take-home money. We call it salt money. It's money for only salt, because what doctors earn now is far, far low than the economic reality of what doctors should earn. It's important that we have that understanding that doctors should not be treated as slaves. Doctors should be given the priority of who they are, because if one doctor is seeing 10,000 patients, man, do the math. That means you must see in a year, you must see over 6 million patients in 1 year.
Wow. Now that takes us to
it's important that government gives the relevant joy and relevant respect to these doctors serving this country, because we're serving this country in a very, very hard time.
So for you, strike is not the option?
Strike is not the answer. But that is a language the government understands. But if the government is proactive enough and addresses the yearnings, the pains of this doctor. For example, the doctor that was killed, we've not even gotten a letter of commiseration from the Ministry of Health or from federal government. And is a very senior consultant psychiatrist in Federal Medical Center in Enugu. Federal Psychiatric Hospital in Enugu. Now, how many psychiatrists do we have in this country? One died. And there is no commiseration from the government. It makes us feel as if we're just walking in this place and nobody will send you. But a politician dies today, you will see a first write-up by government.
So government should show empathy. Government
should show seriousness and empathy, because we are serving the country. We are treating the politicians.
Now,
are you getting my point? No. So let me stress this. It's important. A doctor dies and he has families. Has a wife, maybe 4 children. Government should empathize and take care of the wife and take care of the family. But there are people, there are politicians in this country that died years ago. Their families are still enjoying the benefit of the cake, of the national cake. Am I not correct?
I agree with you.
So the people that have served their life and died in active service, nothing happens to them. I think we should be more serious as a country and respect those that are actually the heroes of our time.
Now let's take a look at technology. Before you came on the show, we're talking about the need for Nigeria to start paying attention to technology. That's the new oil now. Yes. So how can we infuse technology into the healthcare system to get a better result?
We're doing well. At least now we started having telemedicine. We've started having, there are very, very, very great companies doing
I tried that telemedicine one time like that. And it worked for me, yes, it did. Yes. But I didn't follow up because I wasn't just, I wasn't comfortable. Yes. Because I needed to see the doctor I was talking to.
So that's another thing. That one is about information dissemination. People are not comfortable yet not to be touched by the doctor. So
I wanted to see the doctor that I was talking to.
Must touch me, must
feel me,
must see me.
Yes.
But now technology can make you sit down here and see patients in Brazil. Technology has helped me. I see patients in America, Australia. I see patients in Finland because of technology. You have to have a parameter that makes the conversation very secured, and people are open to tell you what they are going through. So, but people must know that it's safe, because technology will make you reach more people. Now that we have less doctors, more patients. So, what will bridge that gap is technology. So you can sit down in your room and say, okay, doctor, I'm sick, and you're in Kafanchan. And the doctor can sort you out and tell you what to do by just having a conversation over the phone or over telemedicine, over AI. Now, because it's important that we invest in it. And the government has done something very good. Last year there was a communiqué at the National Council of Health about the framework of national telemedicine by the Federal Ministry of Health. So that can help us culminate how it should be, how it should function, so people are not taken for granted, and nobody comes and imposes himself that he's a doctor, whereas he's not a doctor. But sometimes because it's technology, now people cannot misuse it.
Exactly.
And that's how Yahoo started. So people misuse things and say, somebody that is maybe he's a farmer in a village and says, can wear coat and says, hey, I'm a doctor. If you take this route and that route, it will give you baby, that kind of. So we must have a framework that regulates the technology, but it's working already, and people are getting it. People are using it already in this country. More information and more frameworks will make it better.
You talked about people accessing healthcare, and that brings me to the National Health Insurance Scheme. What's your take on it? You think it has been very effective?
No.
It has not.
So we have. So he moved from scheme to NHI now.
Yes.
National Health Insurance Authority.
Yes.
And there's a law now. There's a law now that says every Nigerian that breathes and lives in Nigeria should have insurance. It's a law.
Yes.
Lagos has done fantastically well, amazing work they're doing. I celebrate the Professor Akin Abayomi, the Commissioner. I'm not the permanent secretary of Lashma. I think her name is Dr. Zamba Emanuela.
Yes, Emanuela Zamba.
Excellent work they're doing. They've made Ilera Eco very, very accessible to people, and Lashma is doing well with that particular law. But unfortunately, only the civil servants or government workers have entered that bracket of insurance, and the informal sectors are not getting it. That's why we need a lot of information and dissemination and right information, so that the informal sector are more than the civil servants. They need it more, so that people can start accessing this thing properly and getting better using, and especially the rural communities. For me, we're not getting there. Rural communities are those people that need it more, because insurance is about pulling funds together and helping more people. So if the funds are put together, the people that are vulnerables that need it more in the rural communities, in the IDP camps, are those that should benefit more from NHIA. And I believe this year, we had great meetings with the DG last year, and we told him it's important we take the governance from the center of Abuja to those communities. Imagine they see the DG of NHIA in somewhere in Damanturu talking about insurance. It's more valuable than just seeing him on TV talking about NHIA on television. So we must take the healthcare to the people, not the people who come for healthcare.
That's brilliant. Okay, so how important is leadership and accountability in fixing our healthcare system in Nigeria? Let's start from the federal government, the presidency. And then we come to our governors, and of course, the closest to us, the local government chairman.
When they increased when the federal government took away subsidy and the funding for governors or funding for state increased, when I used to follow the FAC distribution, and I saw the monies jump up. It means that there's a lot of money for things to be done properly in this country, and things to be done accountably in this country. I hope that healthcare will be very, very involved in this year, and will invest more, and the governors will invest in the secondary tertiary institution that we have with the general hospitals in this country, and also invest a lot in training of manpower and improving up, so that there's no what we call internal brain drain. What has happened in the last few years? You know what has happened? People leave the primary health center and go to the tertiary, go to the states, then go to the federal, because sometimes the salaries are not the same thing. So we are advocating right now, and we have said in many fora, that we must have what we call universal applicability of circulars. Universal applicability of circulars from government. So if federal government comes up with a circular of increment in salary, it should automatically translate salaries in states and local governments. So that doctors don't leave those local governments empty and say because salary has increased in the state, they go to the state. Because it has increased in the federal, they go to the federal. So what we call it internal brain drain. So if the government today says we're giving doctors 20% increment salary, it should go across board, not just only in federal. It must go in the federal. So the place is very important. The seat of the Nigerian Governors Forum must advocate for increment and value universal applicability. You don't say because I get small money in UB, I can't pay what Lagos is paying. No, because the doctor that is working in UB did the same amount of energy work and intensity of training doctor working in Lagos. So they deserve to earn the same thing. You don't say because somebody works in Kwara, you can't pay like Abuja. So what will happen is that people start leaving those places and gravitating to
exactly.
So we don't want that to happen again this year. So that we have what we call universal applicability of all salary of all salary level. We're working on it already. We're writing the NGF and writing all the governors of the country from NMA, because we just got a corrected salary, a corrected table that has been distorted for the last say 19 years. So we've been underpaid for 19 years. So the government has already just corrected it. So we're writing the government and with this correction, and they said they're going to pay us 18 months arrears on that. It's not bad, but the government of the state's government must also know that as this has been adjusted, there must be adjustment in people's salary and their grades, and they must be able to pay it at par, so that people now don't leave state again and start going to the federal.
So just as we have external brain drain, we also have internal brain drain.
Very correct.
Okay, now we've been talking about the roles of the government, the federal government, state and local government now. But let's talk about the roles of medical practitioners themselves.
Yeah, I like that.
Yes, because they also play an important role.
Yes, leadership.
Yes.
So for me, it's very important. It's patriotism, Hippocratic word. So first is first, the Nigerians doctors are amazing people. They're the best human beings ever. I've seen doctors work for 5 hours straight, work for 5 days straight call because there's nobody to take over from the person. I've seen doctors do 30 days call every day. Yes. So one of the things that NAD is saying that is not efficient, that NAD is saying about that is that it's not effective because you make medical errors. When you work every day for 30 and there's no rest in between, you make medical errors. And who takes the responsibility of the errors you make? Yourself again. So it's important that we celebrate those kind of sagacity, that kind of work we do for this country. So doctors are doing well. If the government and the environment is improved, we'll do better. We're the best human people. You see doctors that go to donate blood for patients. If there's no blood, I've seen it many times, over and over again. We've seen doctors that pay the bills of patients on the hospital because people cannot afford. Yes, I've seen doctors use their money to go and carry a patient that has trauma accident on the road and bring them to the hospital and still treat them. So the doctors are doing very well, but we can improve in leadership, improving responsibility, improving accountability to ourselves, to our goals, and also to the framework of our Hippocratic oath, which means you must feel very safe that am I doing the best? Am I putting my best into what I'm doing? Am I doing well enough to be celebrated? But I tell you, without a doubt, we have the best humane doctors, energetic doctors, sagacious doctors in this country.
Okay, so finally, despite all the challenges that we've talked about now, are there reasons for Nigerians to be hopeful about the healthcare system in the country? Yes,
at least we increased the budget. Budget was increased, even though it's not 15%, it was increased this year. That's said that the government knows the value of healthcare, and 2, there's going to be improvement in NHI this year. 3, the tax law that's happening this year, hopefully will bring more funding to healthcare, hopefully, and will reduce our dependency on international funding. Most times when you get international funding for healthcare, they're the ones that control the narrative of what those money is spent and how you spend it, and you're accountable to them, not to the people you are spending the money on. So I see hope. I'm a very, very pragmatic person. I don't see the cup half empty. I see the cup half full. I believe it's going to be a better year in 2026. We're going to enjoy it better. We're going to have full health care. We're going to have health in abundance. God is going to keep us safe and sound. But we hope that everybody plays their own path in making this thing work for Nigerians and by Nigerians, yes.
Thank you very much, Doctor, for coming on the program, and thank you for sharing your insights with us today. It's been an enlightening and important conversation, and I've learned a lot too. Okay, so he has said it all. An effective health system is not just about, it's not just the responsibility of the government, the medical practitioners, policy makers, and Nigerians. We all have roles to play in ensuring that we have access to quality healthcare system. Doctor, thank you very much. I've been speaking with Dr. Benjamin Oluwojebutu. He's the first I love that name actually. He's the first Vice President, Nigeria Medical Association. We'll take a short break on the conversation, and when we return, Joy and Adebimpe will continue the program. Stay with us.